Okay, so for this deep dive, we're looking at a really pivotal role in hospitals today. It's the director or head of clinical coding and informatics. And our mission really is to figure out why this specific executive job is such a critical nexus point in modern healthcare.
Yeah, it really is.
It seems to sit right where three huge concerns crash together. Clinical quality, obviously. Financial health, that's the revenue cycle management, RCM stuff.
Right.
And then there's the whole digital transformation piece, EHRs, AI. It's a lot.
It is. It's a true hybrid leader.
And you need to understand why they get paid what they get paid.
Oh, definitely. And look, if you need proof that the market gets this strategic shift, just look at the pay.
Okay.
Let's say traditional coding director, they're averaging maybe $95,000, somewhere around there. But compare that to a director of clinical informatics, that salary often jumps way up, over $144,000 on average.
Wow, that's a big difference.
It's huge. And that premium, that gap, it isn't for just managing paper records better. It shows the market is valuing, technical skill and strategic thinking. Risk mitigation.
Okay, so let's unpack that.
Yeah.
This hybrid mandate that justifies, well, $144K.
Yeah.
You said it's a mix, a synthesis of traditional health information management, HIM,
Right.
and the more forward-looking health informatics, or HI. So on the HIM side, what are the core duties, the high-stakes stuff?
Well, that's where every single code translates to dollars, essentially. It's managing the financial and regulatory integrity, meaning doing deep audits, making sure reimbursement is compliant, and really tight clinical documentation, improvement, CDI governance. You have to accurately show how sick the patients are.
Right.
Because if they get that wrong, the hospital could face massive fines or, just as bad, lose out on millions in revenue they actually earn.
Okay, that makes total sense for the sort of financial defense.
Yeah.
But how does someone who maybe started managing records pivot to become this strategic informatics leader?
Okay, that's the HI side, and that's almost purely strategic.
How so?
It's about using data, using technology to actively improve how things run and how patients are cared for. We're talking EHR optimization, building out complex data governance frameworks.
Yeah, it's okay.
Yeah, and making sure data is standardized, accessible. The goal is really enabling high-level decisions, and this is key, predictive analytics for the whole hospital.
Speaking of big challenges, the sources really hammered home that this director has to navigate these huge regulatory shifts, like ICD-11.
Oh, yeah.
That global transition effective since, January 2022?
Exactly, and it's mandatory.
I was a bit surprised how much focus there was on regulatory headaches like ICD-11. It sounds like more than just a software update.
Oh, it's way more. It's a fundamental overhaul of how hospitals classify conditions and, crucially, how they bill for them.
So it requires
Radical changes, new workflows for coding, massive retraining efforts, and honestly, the biggest hurdle often isn't the tech itself.
it's the people.
It's having enough trained people and enough awareness across the organization. The director, they own that entire change management process. It's a beast.
And on top of that, they have to bring in AI, too.
Exactly. They need to figure out how to leverage AI and machine learning. And for two main things, really.
Which are?
Clinical applications, think sepsis prediction, maybe clinical decision support tools, and also operational efficiency using things like computer-assisted coding, CAC.
Okay, so using AI to help with the coding itself.
Right. But that also means they have to lead on developing ethical AI frameworks, working closely with security folks on compliance.
Yeah, it's critical.
And maybe most importantly, ensuring the data quality is absolutely pristine. Because AI is only as good as the data you feed it, you know?
Absolutely. So, okay, let's boil this down. What does this all mean for, for the hospital, for you listening? This director role seems to be the essential link, right, between the doctors and nurses on the floor.
Mm-hmm.
And the bottom line on the financial statements, they're a key partner to the CIO and the CFO.
Indispensable, I'd say.
And success.
Yeah.
It really hinges on them being a true change agent, someone who can actually get clinicians to buy into these new digital ways of working.
That's the crux of it. And if you connect this to the bigger picture, the career path here is, well, it's exploding.
How so?
This job falls under medical and health services managers, the U.S. Bureau of Labor Statistics. They predict that category will grow by something like 28% over the next 10 years. That's massive growth.
Wow.
So a successful director in this kind of role, they're perfectly positioned for C-level jobs down the line, often moving right into a chief medical informatics officer or CMIO role.
So a real transformation from maybe a back office manager.
Exactly. To a genuine enterprise-level executive shaping strategy. It's a powerful shift.